The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, is a crucial tool for social workers. This manual, often referred to as the Bible of Mental Health, provides comprehensive guidelines and criteria for diagnosing mental health disorders. It is an essential resource that helps social workers understand the complexities of mental health conditions. It provides a common language for diagnosing and discussing mental health disorders. This shared language is vital for effective communication among professionals from various disciplines, ensuring that everyone involved in a client's care is on the same page. Think of it as a roadmap. Just as a roadmap guides travelers to their destination, the DSM-5 guides social workers through the intricate landscape of mental health. This roadmap helps us navigate the complex world of mental health. It provides detailed descriptions of symptoms and criteria, helping us identify and understand various mental health disorders. It's a guide, not a rule book. While the DSM-5 offers valuable information, it is not meant to be followed rigidly. Social workers must use their clinical judgment and experience to interpret and apply the guidelines effectively. We use it to understand and support our clients. By accurately identifying mental health conditions, we can develop appropriate treatment plans and interventions tailored to each client's unique needs. The DSM-5 is essential for several reasons. It not only aids in diagnosis, but also helps in communicating with other professionals. It helps us communicate with other professionals. When we use the same language and criteria, it ensures consistency and clarity in our discussions about diagnoses and treatment plans. We use the same language when talking about diagnoses. This common understanding is crucial for effective collaboration and coordination of care. This ensures everyone is on the same page. It fosters a collaborative environment where all team members can contribute to the client's well-being. The manual also helps guide treatment planning. By understanding the specific criteria for a disorder, we can develop targeted interventions that address the root causes and symptoms. By understanding the criteria for a specific disorder, we can develop targeted interventions. This approach ensures that our treatment plans are evidence-based and effective. The DSM-5 is constantly evolving. It is regularly updated to reflect the latest research and understanding of mental health. It reflects the latest research and understanding of mental health. This ongoing evolution is vital for ensuring that our practice remains current and relevant. This ongoing evolution is vital. It ensures that our practice remains current and relevant, allowing us to provide the best possible care for our clients. It ensures that our practice remains current and relevant. As social workers, we must stay updated on any changes to the DSM-5. As social workers, we must stay updated on any changes to the DSM-5. This commitment to ongoing learning and professional development is essential for providing high-quality care. The manual is not without its limitations. It's important to remember that while the DSM-5 is a valuable tool, it is not infallible. It's important to remember that. The DSM-5 provides a framework, but it does not capture the full complexity of individual experiences. The DSM-5 provides a framework, but each person's experience with mental health is unique, and we must consider this individuality in our practice. But each person's experience with mental health is unique. We must use our clinical judgment and empathy to truly understand and support our clients. We must use our clinical judgment and empathy. These are key when applying the DSM-5 in practice, ensuring that we provide compassionate and individualized care. These are key when applying the DSM-5 in practice. By combining the guidelines of the DSM-5 with our professional expertise and empathy, we can offer the best support to those we serve. The DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, organizes mental disorders into various categories. This manual is a critical tool for mental health professionals, providing a comprehensive classification of mental health conditions. These categories help us understand the different ways mental health can be affected, offering a structured approach to diagnosis and treatment. Let's look at some of these major categories in more detail. Anxiety disorders involve excessive fear, worry, and anxiety that can interfere with daily activities. These disorders are among the most common mental health issues. Examples include generalized anxiety disorder, which involves chronic anxiety, and social anxiety disorder, characterized by intense fear in social situations. Depressive disorders are characterized by persistent sadness, loss of interest in activities, and significant changes in sleep and appetite. These symptoms can severely impact a person's quality of life. Major depressive disorder is a common example, often requiring a combination of therapy and medication for effective management. Bipolar and related disorders involve shifts in mood, energy, and activity levels, ranging from manic highs to depressive lows. Bipolar I disorder and bipolar II disorder fall under this category, each with its own unique pattern of mood changes. Trauma and stressor-related disorders develop in response to a traumatic or stressful event, affecting a person's ability to cope with daily life. Post-traumatic stress disorder, or PTSD, is a well-known example, often seen in individuals who have experienced severe trauma. These are just a few of the categories outlined in the DSM-5, each encompassing a range of specific disorders. Each category encompasses a range of disorders, providing a framework for understanding and treating mental health issues. Each disorder has its own set of criteria, which must be met for a diagnosis to be made. Social workers must familiarize themselves with these categories to provide effective support and intervention. This knowledge is fundamental to our practice, ensuring we can offer the best possible care to those in need. The DSM-5 provides specific criteria for each disorder. These criteria are essential for diagnosis. They outline the symptoms that must be present. They also specify the duration and severity of these symptoms. Social workers use a variety of methods to assess for these criteria. We conduct clinical interviews. We gather information from the client's history. We may also use assessment tools and scales. It's important to remember that the DSM-5 is a guide, not a checklist. We don't simply check off boxes to make a diagnosis. We consider the whole person. This includes their social, cultural, and environmental factors. Applying DSM-5 criteria effectively requires training and experience. It's not something we learn overnight. Ongoing professional development is crucial. We must stay updated on the latest research and best practices in diagnosis. Section 4. Familiar faces. Common disorders encountered by social workers. Social workers encounter a wide range of mental health disorders in their practice. Some disorders are more common than others. Here are a few examples. Depression. This is one of the most prevalent mental health disorders. It affects millions of people worldwide. Anxiety. Anxiety disorders are also very common. They often co-occur with other mental health conditions. Trauma. Many people we work with have experienced trauma in their lives. This can have a profound impact on their mental health. Substance use disorders. These disorders involve the misuse of alcohol or drugs. They often occur alongside other mental health issues. These are just a few examples of the disorders social workers may encounter. It's important to be familiar with the signs and symptoms of these disorders. This allows us to provide timely and effective support. Section 5. Real-world applications. Using the DSM-5 effectively. Let's look at some practical examples of how social workers use the DSM-5 in real-life scenarios. The DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, is an essential tool in the field of mental health. It provides a standardized classification of mental disorders, which helps professionals communicate about their clients' conditions and plan appropriate treatments. Imagine a client presenting with persistent sadness, fatigue, and difficulty concentrating. These symptoms can be quite distressing and impact their daily life significantly. These symptoms could indicate depression. By using the DSM-5, social workers can systematically assess these symptoms and determine the severity and duration required for a diagnosis. The DSM-5 criteria for major depressive disorder help us determine if the client meets the diagnostic threshold. This ensures that the diagnosis is accurate and based on established guidelines. Or, consider a client who has experienced a traumatic event. Trauma can manifest in various ways, and it's crucial to recognize the signs early. They might be having nightmares, flashbacks, and difficulty sleeping. These symptoms can be debilitating and require immediate attention. These are common symptoms of PTSD. The DSM-5 provides detailed criteria for PTSD, which helps in making a precise diagnosis and planning effective interventions. The DSM-5 criteria for PTSD guide our assessment and intervention planning. This structured approach ensures that we address all aspects of the client's condition. The DSM-5 is also helpful for case formulation. It allows us to integrate various pieces of information to understand the client's overall situation better. This involves developing a comprehensive understanding of the client's situation. By considering their history, symptoms, and current functioning, we can create a holistic view of their needs. We use the information gathered to create a treatment plan tailored to their unique needs. This personalized approach increases the likelihood of successful outcomes. Remember, the DSM-5 is one tool among many. It's important to use it in conjunction with other resources and our professional judgment. We also rely on our clinical judgment, empathy, and ethical principles. These elements are crucial in providing holistic care. The goal is to provide compassionate and effective support to our clients. By combining the DSM-5 with our skills and knowledge, we can make a significant positive impact on their lives. Section 6. The cultural lens. Recognizing diversity in mental health. Cultural competence is paramount when using the DSM-5. Culture shapes how we experience and express mental health. What is considered normal in one culture may be different in another. We must be aware of our own biases and assumptions. We need to approach each client with an open mind and a willingness to learn. This includes understanding their cultural background, beliefs, and values. The DSM-5 provides guidance on cultural considerations. It includes a cultural formulation interview, or CFI. This tool helps us gather information about the client's cultural context. By integrating cultural competence into our practice, we can provide more sensitive and effective care. We can avoid misdiagnoses and ensure our interventions are culturally appropriate. Section 7. A force for good. How the DSM-5 empowers social workers. The DSM-5 is a powerful tool when used responsibly and ethically. It empowers us to advocate for our clients. A diagnosis can help clients access resources and support. It can also reduce stigma and increase understanding. Develop effective treatment plans. By understanding the specific criteria for a disorder, we can target our interventions more effectively. Collaborate with other professionals. The DSM-5 provides a common language for communication among mental health providers, contribute to research and knowledge. The DSM-5 is based on scientific evidence and is constantly evolving. By using the DSM-5 effectively, we can help our clients live healthier, more fulfilling lives. We can also contribute to a more just and equitable mental health system.